on this Wellness Wednesday. Sniffles, sneezing, and sore throats, I guess I should say. The cold and flu season and the holidays are in fact upon us. And as we head into this hectic time of year when we tend to stray from our daily routines and regimens, and no one wants to get sick, right? So we invited Dr. David Winter of Baylor Scott & White Health to tell us what we need to know. Good morning to you.
Good morning. Good to be here with you.
I'm so glad to have you here because we are in that time of year.
Yes, we
so
are.
tell me, what are you seeing right now?
Lots of phone calls, lots of visits, lots of viral infections. Now, we usually see a surge this time of year, but I'm seeing more than usual, so I'm concerned about that. Fortunately, most of these folks are mild to moderate symptoms. I hadn't had to hospitalize anybody so far, but a lot of viruses out there right now.
Okay, so we do need to be cautious, but like you said, nobody hospitalized just yet.
Not yet.
Why do you think these infections circulate more during the fall season?
Yeah, it's said that the dry air and the cool air tends to let viruses grow. We're not sure exactly what that's all about, but they seem to do better with that. And the fact that we have dry nasal passageways, our immune system can't get there and fight that as well as we could. Of course, people tend to congregate more.
Exactly.
The more you're around people, the more you can spread these viruses from one person to the other.
So how can we distinguish the viruses, the bacterial infections, and then those from just those regular allergies that we typically get?
It's quite a challenge. In fact, there's a lot of overlap. I mean, you can't really tell for sure. Symptoms, there are a little bit of difference, but when I try to bet on that, I can be wrong 25% of the time. So if you really have an infection that needs to be treated, you got to get a treatment. You got to get a test for it.
Okay, so making sure that we're staying up on our testing as well. Okay, I like that. But how long do these viral infections typically last? How long can we determine that we'll be down and out if we do catch it?
Yeah, usually they're bad for 2 to 3 days, then taper off.
Okay.
In 7 to 10 days, you should be well. Now, if you're not well in 7 to 10 days, we have to think maybe there's a secondary bacterial infection, maybe some compromise with your lungs, your heart. That's when you need to talk to your doctor.
Okay, so don't let it get too far. Making sure that. Okay, what about treatments? How do they differ as far as those infections versus allergies?
Important question, because the antibiotics that work for bacterial infections don't work for viruses.
Okay.
The medicines that work for COVID don't work for influenza. Influenza medicines don't work for COVID. You have to get a diagnosis. You have to get a test. Now, you can get a test kit from the pharmacy now.
Okay.
Or most doctor's office, urgent care centers have those. But when people ask me for treatment, I say, let's get a diagnosis first.
You know, I'm glad you said that because I think there's a lot of times where we just naturally have that medicine drawer, right? That we just stick all the old medicine that we didn't finish or didn't take from the last time we were sick, and then we try and put it in use. But you're saying it's not necessarily going to work, and we need to keep that in mind. So going to see the doctor is our best bet. What about those vaccines? Because you did touch on COVID, influenza. You said those can't be crossed as well. Should we still be getting both?
The vaccines may not prevent you from getting the virus, but they can prevent you from getting a sick case, a really severe case. So I am in favor of those. They do work, particularly if you're older, if you have some immune problem, if you take immunosuppressive drugs, you ought to consider those, because otherwise you can get in big trouble with these viruses.
Okay, and then as we go through this time of year, right, because we're just getting started, we're at the beginning, how can we minimize, if we can, any way of contracting those infections?
Most importantly, wash your hands. Just imagine if somebody is sick and they touch a doorknob and then they touch any kind of object and you touch that, then you put your hand on your nose, you got it.
You guys, I just want you to hear it again. Washing of the hands, okay? Washing of the hands.
And for 20
it's so
seconds.
easy.
You got to count to 20. It's a lot longer than most people think when you wash your hands.
Okay, so keeping that in mind, rubbing in the soap for 20 seconds, okay? And then all the extra time can be used to rinse it off. Very good. What about our immune systems? You brought that up earlier. Is there anything we can do to boost our immune system?
Lots of studies have shown that people that have a good balanced diet, that exercise regularly, get good sleep, they stay hydrated, and try to minimize your stress when you can. That keeps your immune system in tip-top shape, and that's what you want.
Yes, it is. Yes, it is, especially during this time of year. Thank you so much, Dr. Winter. Tell us where we can find you.
David Winter, bswhealth.com.
Very
good to be with you.
Thank you so much for being here. We appreciate you keeping us healthy during this time.